Usually about an hour after we get you up to the intensive care unit, family can come and visit you, although you'll still be asleep and on a ventilator. As you wake up, typically 2 to 6 hours after surgery, we get that breathing tube out of your throat. After that, it's usually just overnight in the intensive care unit. The next morning, we'll have you sitting up in a chair, and we'll also start to remove some of the monitoring catheters and transfer you to the telemetry unit. Once we get you to that floor, cardiac rehab and physical therapy will help you walk the halls several times a day. Respiratory therapy will also work with you, and day by day, all of the tubes and IVs will come out. The first day or two after surgery, you're incredibly thirsty and your mouth's very, very dry. You have no appetite and nothing tastes good. Your sleep patterns are also messed up. You'll be dead tired during the day, falling asleep, taking little naps throughout the day, but then at nighttime you may be able to fall asleep, but you'll wake up and not be able to go back to sleep for another 3 or 4 hours. It's very common to have hot flashes after surgery, even men. You'll suddenly feel very warm, break out into sweat, wanting a fan blowing on you. After a few days of that, it's very common to be cold and chilled and wanting warm blankets put on you. You have absolutely no energy. Just getting up and walking around the nurse's station completely wipes you out. Gut hormones don't work after surgery, so nothing moves through your system and you can get very constipated. We'll give you medicines for that. Kidney hormones don't work after surgery, so you retain fluid. We give you medicines for that. Insulin hormone doesn't work after surgery, so your blood sugars are all out of whack. Our nurses will be poking your finger 4 times a day to check on your blood sugars. They'll even be coming to give you insulin shots, even though you don't have diabetes. It's critically important for us to keep your blood sugars under control. In young women who are still menstruating, it's very common to start their period on day 3 or 4 after heart surgery. There are emotional effects from anesthesia as well after surgery. In the first few days to a week after surgery, it's very common to be suddenly overcome with emotions where you get all weepy and teary. 5 seconds later, it goes away. It's also common to experience hallucinations, vivid dreams, and visual disturbances. During your hospital stay, we'll have cardiac rehab see you, as well as physical therapy will come and see you. Our nurses from the office will come talk to you, and you'll also be seen by our nurse practitioners at the hospital, as well as residents that we have on our service. Everybody is working together to give you the best care possible. When you're ready to be discharged from the hospital, typically 4 to 6 days after surgery, we'll go over all of the what to do, what not to do, how to go about doing the things we want you to do, which medications to take, follow-up appointments, phone numbers to call. All of this information is printed out for you, put into a binder for you to take home. It's critically important that you review this information several times once you get home.